with some information. Unfortunately, Gian Pietro is not there. He's trying to help Henriette. So we advise you in general to switch off your camera and microphone if you're not speaking, if you're not on the floor. So to ensure a better sound for everyone and minus lag, of the platform, the malfunctioning of the platform. So only the moderator should be on, and if he calls you on the floor, you can of course switch on your camera and microphone and start your session. Please stick to the plan, be on time, because we cannot stay longer, and also the platform will automatically start a countdown at the end of your session, which is at 10. We'll start a countdown of about 10 seconds, and the session will be automatically closed, and you don't want your attendees not to be greeted. So yeah.
Sorry, Sasha Lukianos, if Henrietta is not here, will you take over?
I suggest Luciano starts.
25 seconds. Me and Peter will switch off our camera and microphone, but we will be like ghosts. We will be there to help you if you have any IT issues. So don't worry. You will be on air in 8 seconds. So good luck to everyone, and I hope you will enjoy this session. Bye.
Bye-bye. Thank you.
Gian Pietro, are you around to take over? Okay, I will make a start. Good morning, ladies and gentlemen. Welcome to this co-design workshop for Horizon Europe. I am Lukianos Gadzoulis from Patientcentered. I co-moderate this session together with my colleague Sasha Yenko from DG Reform and also with Henriette Van Uyl from DG RTD. Henriette is supposed to be our lead moderator this morning. Unfortunately, she experiences some connection problems. Therefore, I'm stepping in temporarily, and when Henriette manages to connect, I will hand over, of course, to her. Let us move to the next slide, please. What we are discussing about is research. Oh, I think I see Henriette arriving. Henriette, I haven't gone too far. I just moved one slide. I would really like to hand over back to you now.
Yeah, good morning, everyone. Good morning, colleagues. Good morning, Lukianos and Sasha. I'm really great that you're here. Apologies for a short delay. We're trying to fix IT things. So, welcome to this session. This is a co-creation session, and this is the co-designing session for cluster number 1. Indeed, my name is Henriette. I will be able to coach, navigate, and engage you all in co-designing session in the coming 1 hour. So there will be a 10-minute introduction followed by 3 questions that we have prepared for you. And I hope you don't mind that we have questions for you. And then we can discuss the questions that you have for us. Indeed, Lukianos has already started to frame this session. And really, the session is about what R&I is needed for long-term sustainable green, digital and economic transformation for health and care in Europe. And in the meantime, you will see some pop-up questions, because we would like to know who is in the room, and it's always nice to know who's in the room with you in the session. So my first question to the organizers was actually, what is a co-design session? What are we going to do today? And this co-design, I was told, is an opportunity to discuss with you a wide range of people and expertise about a very important topic. And this topic today is about social and economic transformations. So there are two co-design sessions for health for cluster one. And one was yesterday afternoon at 4 o'clock, and that discussed the short-term measures for healthcare transformation and what the role of R&I would be in that. And there we discussed a lot about what could be the R&I contribution to deal with the impacts of COVID-19 and how can we get out of that. Now, today we have in this second session a more longer-term perspective, because coming out of COVID-19 has also some ramifications, and we would like to take this opportunity to also include and bring in the green and the digital side. And really, this is about sustainability and many more aspects than just sustainability of finance in healthcare or sustainability in patient care, access to patient care. Because obviously there are also many other elements like zero pollution, circular economy, and the chemical strategy. There's a huge wave of digitalization of healthcare in artificial intelligence, data. And obviously healthcare is with and for people. So it's about access to healthcare, resilience, and also strategic autonomy, making sure that we actually have the equipment in Europe and with our partners to do healthcare. So this is quite a long and quite technical introduction, and really it's about issues that I would like to discuss with you today, which is about data-enabled research. It's about what is needed for sustainability regarding the products that we use. It's about what kind of lifestyle issues can we research and innovate in, and that also impact not only on economic behavior but also on healthcare behavior. And then finally, we have set up a number of tools and instruments to do this together. So you have seen them already, but I cannot address this complex matter myself. So that is why I've brought in two colleagues of mine, Lukianos Gatsoulis and Sasha Jenko. And Lukianos has just started talking with you. And Lukianos combines a background in biomedical engineering and in wireless communications. You started your career in the Commission in the digital side, working on e-health and aging. And then you moved to DG Santé, to the healthcare department of the European Commission. And there you are involved in the knowledge and national health systems, innovations and investment in health systems, and new care models and integrated care. So I'm really happy to have you here with me, because that really brings in a perspective, a long-term sustainable perspective. And I'm also very happy to have my colleague Sasha Jenko with me today. Sasha also holds a PhD in biomedicine. You spent some time at the Johns Hopkins University in Embo, and also you were a Fulbright scholar in Berkeley. Impressive academic career, which you then used to come to DG Research, where you were my colleague in the public health sector. And now, recently, you moved to a little-known Director General called DG Reform. And I asked, what does DG Reform do? But DG Reform helps member states with designing and implementing healthcare reforms. And you're doing this as part of a healthcare team in DG Reform. And what is really interesting about you is that you discuss day-to-day with the member states, with public healthcare providers, about how to implement innovations. And then finally, my name is Henriette, and I'm a virologist by training, PhD from Oxford. And currently, I lead a team that deals with economic and social transitions here in the Commission, DG Research and Innovation. And one of our tasks in E6 here is to drive forward the preparations of 4 out of the 6 Horizon Europe clusters. But really, in the last 9 months, our work has been taken over by driving forward and developing all these actions in COVID-19. And if you want to know more about COVID-19, I would highly recommend the session tomorrow at 3 o'clock, which is really about EU action in COVID-19. So now we come back to where Lucianus finished off. Thank you very much, Lucianus, for stepping in. Really proactive. So where are we now? So Lucianus mentioned that the Horizon Europe proposal has 4 big pillars. You're now in pillar number 2. Health comes on top, but health is a very important cluster. It's cluster number 1, and in cluster number 1, we're going to today together co-design the strategic plan of cluster number 1. And co-design meaning doing this together. And we're going to co-design the strategic orientations for the coming 4 years, so 21 to 24. And if we go to the next slide, please. These strategic orientations, the preparation of these strategic orientations has been a long process. You don't do this in a weekend. You actually take a year and a half for doing this. And we started with a very open and wide web consultation back in 2019. The first discussions, and many of you were there at R&I Days last year. And this produced an orientations paper. So basically, what would be the orientations for research and innovation priorities for the coming 4 years? Not for each year, but for the coming 4 years. So this gives a more strategic helicopter view of what needs to be done in the coming 4 years. Many of you have also participated in a web survey, which just won the last 2 weeks. And now today we're doing the R&I Days, where we gather even more information from you and with you about what would be the strategic orientations for the coming 4 years. So if you go to the next slide, all these preparations and discussion in the last 18 months have already led to 6 major orientations. And these major orientations are developed into 6 targeted impacts. So these are the 6 targeted impacts that together with you and member states and many consultations have already been produced. So these would be the 6 targeted impacts for the coming 4 years in Horizon Europe in the health cluster. Obviously, there are many other impacts for other clusters and other parts of Horizon Europe, but this is just especially for cluster number 1. And so I would like to frame this discussion with you around these 6 targeted impacts. What are we missing? What do we need to expand on? And where do you see further gaps or further opportunities? So if we go to the next slide, please. So what does this mean, co-designing? And here I would like to bring in our 2 panelists, because you have 6 targeted impacts, but there is also in transformation a more strategic and a very long-term policy needs. And when we were preparing this session, which is always a great way to connect and to discuss really what motivates and what brings us here and what interests us in our daily work, Sasha made a very provocative observation, and she said, Henriette, the challenge is obvious. You guys in research, you create the future, and sometimes also some crazy ideas. Lucianus meets and collaborates with health ministries who set policies like regulatory frameworks and health care assessments. And then the public authorities call me up, Sasha, because the technologies go too fast and we need help to make it happen in reality. So I'm very happy that Lucianus and Sasha are here because I would like to bring you in to both defend and explain this, please. So Lucianus, your counterparts are mainly in health ministries. What are their main needs? If you look at healthcare and research and innovation, what is the sense of direction now in the next 10 years? And then I would like to bring in Sasha, because you have already seen many projects that you do together with your colleagues and member states. And what kind of reforms are they looking for, and what are the difficulties in implementing these innovations? So first, Lucianus, what is the general sense of direction and the policy needs? Thank you.
Right. Thank you, Henriette. I think it is quite a while now that policymakers recognize the need to reform and transform health systems in order to mitigate better challenges and find solutions for this. And this is not really something new, but the recent COVID-19 crisis has brought certain things to the fore in order to perhaps accelerate the travel to address structural weaknesses and make health systems more resilient and more efficient and more accessible and more sustainable. So a long-standing aspect is certainly the need to move to a more effective prevention and management of diseases. And a lot of discussion and thinking goes into how to make this more person-centered, move away from disease silos, better connect the players who are involved here, and empower people to look after their health, to stay healthy, to stay fit, but also to manage themselves, their conditions, with the help of innovative tools and services, of course. Now, a major part here is we need to depart from the current way of doing things. So we're looking into changing the way care is organized and delivered, transformed, but this is on a number of fronts. One is, for instance, to make better use of digital tools and technologies, to introduce them into the service, into the patient pathway. Another one is to better connect all the actors who are involved in the delivery of care, in the organization of care. That means actors at primary care level, at specialist care, hospitals, social care, but also the caregivers for patients and the patients themselves. And all these changes would actually require, if they were to work properly, a different set of roles for the healthcare workforce. And we have seen this happening in some localities and regions who attempt to implement these changes. New roles which also require new skills. Skills, for instance, to use the digital technologies, or skills to upskilling nurses to act as care coordinators. These are some examples. COVID-19 has underlined the importance of having resilient health systems, systems which can absorb shocks, they can recover quickly, and they can retain their day-to-day operations. What we have seen in many countries was the postponement of services, of care services, especially some screening, some planned surgeries and so on, in order to devote healthcare facilities and staff to look after COVID-19 patients. Postponing care creates longer waiting lists, which will be very difficult to absorb. So here is a very illustrative example how much health systems need to improve in order for these things not to happen. So this is like in 3 bullet points that you see in the slide, some key principles and directions of travel. And certainly research and innovation can contribute to this, because we will be looking for effective, efficient, cost-effective solutions to make this happen. Thank you.
Excellent. Thank you, Luciano. So what I see is that on top of the normal, ongoing long-term challenges now, resilience has become really an overriding challenge. And I think later in the session we will dive and tease out that comment a little bit more. But Sasha, so you are in touch with public health authorities, healthcare deliveries, and when are they calling you up? Over to you.
Good morning, Henriette. Good morning, everyone. Good morning, Lucianos. Thank you very much for a nice introduction to both of you. So indeed, I have to say that my passion is really on how to translate all these crazy ideas, innovation, and solution into the health systems. What we see in DG reform is that, of course, I mean, everybody knows that it is a long-term process, but it really requires visionary thinkers and then very stubborn leaders to make it a reality. Technology and innovation are here, but what is really lacking is the cultural change. The cultural change, even of the government officials. So what I would like to give is maybe a couple of examples to back up the policy, DG Sante's policy. For example, in keeping the citizen healthy, we help the member states in implementing different cancer screening guidelines, for example. We are doing that in a multi-country project in Italy, Romania, and Slovakia. Then when it comes to all kinds of transformation of health systems, talking about digitalization, integration of care, what was already mentioned before by Lucianos, we do a lot of capacity building of the government officials, of the insurers, of the healthcare providers. What we do is we also offer different types of analysis, different types of designing of new strategies, different types of redesigning and rethinking the whole governance of the e-health systems. These are just a couple of examples. And the last bullet point, which is about strengthening the resilience of health systems. A week ago, we sort of organized a discussion with the DG Reform projects on how they coped, especially the health ministries, how they coped with the first wave that hit us in the spring, and what did they see as innovations, what was it? And actually what they told us is that the COVID was actually a booster for innovation, and we could see that things that were not possible before, for example, reimbursing telemedicine and so on, were possible just in 2 months. So yes, with that, I would like to end my intervention now, and I would hand over to Henriette. Thank you.
Yeah, excellent, Sasha. And what I take for you is to do innovation and to implement it in systematically in healthcare provision. You need strong leaders, some crazy ideas, some very good ideas, but also turning into a crisis. Well, we've said it many times, in an opportunity, but at least learning and seeing how things can be done differently. And I think that COVID forced us a lot. So I'm really grateful for that, for those points, Sasha. So now we're going to go into the work part of this session. And we have prepared 3 questions for you. And these we're going to say, and these 3 questions are really about inviting you to think about and to reply and to define answers towards 3 questions. And one, and they are here presented on the screen. One is around RNI results. So what are the RNI results that are needed for achieving the targeted impacts? And it's really around sustainable social and economic transformation of our healthcare system. So about a longer term. Then secondly, what can we do? What are the health research innovation that we can deliver to support this in medium and long term? Then also, we are all part of a system, of an ecosystem, of a community, and there are many other issues, like Sasha said, leadership, passion, but also issues around gender, inclusiveness, and availability of education and training. And I think this is what Lucianos mentioned as well. It's really about also changing and working with new types of skills. So that is what would be the third question about. So 3 important questions. And we have set up an IT tool which helps us to collect those answers. And you have already seen the polling about who is in the room. But now I would like to invite you to answer each of the questions one by one. We're going to do this in 3 blocks. So the first block is around what are the RNI results needed. The second block is around what kind of R&I do we need to get sustainability, not only socially, economically, but also ecologically in our health systems? And the third question is about what other issues do we really need to work on? So we have set up this tool, and basically we have the chat box that you can use, and we have a Q&A box that you can use. And I tell you, yesterday in the first session, nearly everyone used the chat box. So I would like very much to invite you to use the chat box to bring in and to list your comments there. And we will engage with the chat box all the time for the rest of the session, together with my two panelists. So the first question, if you can put that up again, and it's also in a new word that I learned, a sticky note in the chat box. So really, I would like to invite you to look at this first question. So we have, in the last 18 months, already developed those 6 targeted impacts. And what are the R&I results that we need for that? And while I see you and I hear you thinking, I would like to pose this question also to Sasha, because you already said that COVID has changed a lot. It changed a lot of the types of questions. But maybe could you give some examples, 1 or 2 examples of technologies that healthcare providers are very much interested in? And also, what are the bottlenecks? And then at Lucianus, my question would be, you're working a lot with country recommendations, and what kinds of innovations are often mentioned in these country recommendations as solutions? So Sasha and Lucianus, you have the floor, and your first reflections on this question, and then we are going to take in all the comments that are coming in. Thank you. Sasha.
Thank you, Henrietta. So what we see with health systems is that they are like huge data creators. So they are data rich, but the problem is that they're information poor. So the problem is basically how to translate all this information into evidence for policy making. And here I think that Lucianus can complement me later. There are, of course, all kinds of new technologies such as artificial intelligence tools, machine learning, and so on. And member states are definitely interested. But before you actually introduce those kind of technologies, you need to have a very organized data landscape. You need to have legislation in place so that the data can be actually used. You need to have different kinds of tools so that the citizens only enter data once, and so on. And this is where we help with the technical assistance. On the other hand, there are other technologies such as genomics, profiling, and so on. And this is what we help again. But again, it is not about bringing the tools and innovation into the system as such and developing new tools and innovation, but it is about how do you actually make that change? How do you translate them into the system? How do you build the capacity of the public health officials, of the government? How do you actually communicate it to the public so that there is that they understand, that they are literate? The problem in Europe is that half of the people is not digital and health literate, and this is where we have a big work to do in the future. And over to Lucianus.
Yeah. Lucianus, please.
Yes, I would like to add to what Sasha said. She made a very good point about data and actually knowledge of what is required. The country-specific recommendations do not really refer to any particular technologies or solutions that need to be applied. They refer to big system issues that need to be addressed and improved. For instance, recently in this year's semester, all 27 member states received a recommendation to improve the resilience of their health system. Others received also recommendations to improve accessibility. In the past, we had recommendations specific to the sustainability of the health systems. So this is like the big goal set in the recommendation, and then it is up to the member states to configure how they can approach it. I think in most cases, it is well acknowledged and known what needs to be done and what solutions are good candidate solutions to address it. The big issue is the how.
Okay.
Distilling these options and the knowledge into a workable solution. How do you do it in a way that it works and you don't actually waste your money, waste your effort? So here comes a bit of knowledge, as a matter of fact, an essential piece of knowledge explaining to people how to do it. Some pioneering health authorities managed to create some successful attempts and create some knowledge as well. This is guidance for many others on how to proceed. And the capacity building are the two words that Sasha used that we are not fed up repeating time after time.
Excellent. And what I see coming in are comments that are around that, so really reflecting the needs of patients and citizens. I also see comments coming in about we have a lot of common platform technologies that can support evidence-based, that can support new clinical practices. And I also see many participants, and I'm really grateful for that as well, who say, well, actually, we need to invest a lot more in basic science, and basic science as in discovery, in understanding what disease is, and understanding what that means for diagnostics, understanding what that means for care, and I see a number of participants looking into manufacturing technologies like sensors and AI. So these are all quite big areas. So discovery, understanding of disease, better understanding the end user, whether it's the system or the patient, and also looking at platforms, being better at providing an ecosystem in clinical trials and in data sharing. Does that resonate with you and with, for example, evidence-based policy making for you, both Sasha and Lukianos? So this is the type of thing, because Lukianos, you mentioned it's really about, and what I picked up from you is really about creating from innovation to a pilot to systemic uptake.
Indeed, I think the evidence-based, you hit it there. And maybe, actually, could we go and show the slide that we skipped temporarily, the slide with a cycle? If we can go a few slides back, 2-3 slides back, please.
So while you're talking, so this is the very fundamental principle in going from research to a clinical practice, correct?
Exactly. One more slide backwards, please.
And again, from clinical practice back to basic science. Yes, so this, here. You're telling me this is really a lot of the answers, a lot of the inputs here can be connected to this cycle.
Exactly. So some of the things that have been phrased, and as you summarized it, they actually put us, let's say, our starting point is the 5 o'clock position of the cycle. If you want to take it like this, we start from the policy angle and the direction of travel that we mentioned earlier. And we move clockwise and we go into the part which is all about building evidence, which is just being discussed. And this is actually the starting point of the practical work in improving the health systems, looking at the evidence and making these evidence-based decisions to look for solutions and afterwards to implement the solutions. So going clockwise again, we will find ourselves at the 11 o'clock position for the research and innovation, which is where we will be trying to identify the solutions that can give us the answers to what we want to address. And then working again clockwise to the 12 o'clock position is from the successful research results and their application on the ground, proven concepts, successful pilots will identify what works well, where and why. And we can call them best practices. And then try to replicate these best practices to more locations, build the capacity how to do it, tailor it to the local context, which matters a lot. We cannot simply copy-paste a best practice from location A to location B. And then, if this process is carefully done, with the right support and know-how, then we can actually roll out a successfully transferred practice to a full-scale deployment. And hopefully we close the cycle by saying we actually met our policy goal.
Excellent. And what I see is so many touching points where I see input saying, well, where are the needs of vulnerable groups? How do we share data about clinical trials? Because sometimes you have very small scale clinical studies, but we want to learn and want to share the data of those. So how do we work with citizens? How do we articulate the needs of citizens? And there's a lot of research needed for that as well. So I really like the cycle approach, and that is also a nice bridge to the second question that we want to pose to you. And really that is about, and I would like to ask my colleagues in the who control the slides to move forward again to the, see if I can do this forward myself, to the second question, which is around long-term, medium to long-term RNI challenges for health research, and really looking at sustainability in many aspects. And I already saw a comment of one of the participants about sustainable manufacturing, not only for in times of peak needs, but also sustainable manufacturing in terms of doing this ecologically sound and reducing waste. So I would like to ask all the participants to reflect on this, building up what you've already mentioned in the first question. And I would like to bring in a comment that was made by Santiago, who was a panelist in yesterday's session, and he really looked at this overriding issue of not only sustainability but also preparedness. So what does a flexible, sustainable, prepared health system look like? There are many adjectives that we come into this, and what can we learn from the current phase? So, for example, the healthcare system creates a huge amount of tons and tons of hospital waste. We've seen in the COVID crisis that there was a huge shortage in masks. So already a number of companies and researchers stepped in and said, okay, we can recycle. We have some technology available to quickly sterilize these masks, recycle them, and you can reuse them. So what kind of green digital convergence technologies do we need for this? Do we need to make Europe climate neutral by 2050? And what can the healthcare sector, which is a huge sector in our GDP, contribute to that? And maybe Lucianus, I know that you have been while I invite participants to think about this, and Lucianus, you have been working a lot with the European Investment Bank on hospital renovation type programs, where it was really both about improving care, but also improving the energy consumption of hospitals. So how did these conversations look like? Who triggered those, and what happened in those conversations? What do you see as trends there?
Well, I think there is a very clear acknowledgement that the health sector itself contributes to the gas emissions quite considerably, as a matter of fact. If you look at reports detailing the percentages. So there is certainly a scope and a need to reduce the carbon footprint. Now, there are various sources which cause that. One of them is infrastructure. So greening healthcare infrastructure, either the existing one or building greener hospitals and primary care facilities, is one way of doing this. And there have always been environmental considerations in all the financing that the European Investment Bank grants. So this is something that has been there for a long time, but we have actually seen now the health authorities do look into this much more than before.
Excellent.
There is also the manufacturing aspects that you mentioned are very important, because the health sector consumes a lot of products. So the manufacturing, the use, the disposal of these products is another source of carbon footprint, if you want to call it like this. And certainly we need to look at greener materials and processes. The digital transformation of healthcare may help with this, because we can actually reduce, for instance, transportation for patients to go to their appointments. But also we need to look into the renewable energy sources to support the digital systems which require energy.
Excellent. And Sasha, you're working in the health team of the DG Reform. I'm sure you're also talking to the digital and the green team. So what are the types of conversations you have with them?
So thank you, Henriette. With the digital team, yes, we do collaborate. We co-design, as you do here in RTD with all the other DGs, we co-design internally. So what we try to make sure is that whenever we have to implement or redesign an e-health strategy, or we tackle interoperability issues, we do it hand in hand with the whole governance of the whole government in the country. So we collaborate a lot. On the green, I came across a paper yesterday, and it says that there is the need to somehow push this healthcare sustainability science. Of course, I mean, Lucianos already mentioned the production and the sites, the hospitals, and so on. But I mean, again, here we need to put the citizen in the center, and we have to somehow use this sustainability research, ensure that all the environmental assessments also consider clinical resource use, pollutions, health outcomes, cost of healthcare services, and so on. So it's a lot of stakeholders need to be involved to actually tackle the green challenge as well.
And what I really like is the discussion that is now happening in the chat is a lot about what facilitates, what makes this happen. And what I see is many comments and about, okay, guys, but 5 to 15 years is a very long time. We need a lot more basic understanding, but not a fundamental understanding of the problems before we can discuss anything around impact. I also see a lot around what are the framework conditions of this? Are they? Can we think about new types of regulation that make possible combinations of diagnostics, test, lab on chip, sensor? So, what kind of regulatory barriers do we need to overcome? And maybe it's not another maybe, but I also sense from the comments that a lot of research is needed in defining some of this new regulatory context. So what does it mean, new regulation, that when we come into healthcare, but also data and privacy issues? And I also see many comments about, okay, if green and digital and healthcare come together, do we have the right organization? Do we have the right teams, the right skills that we bring together? So these are quite poignant and quite not only important, but deeply connected, and also very much nearly interfering and shaping the future. So I would like to thank the audience for bringing this up. It's really really very interesting. Do you see anything that you would like to pick up on, Lucianus and Sasha, in the comments, the specific of your interest? I see, for example, also the issue of pricing. Maybe that is something that both interests you.
Maybe I would just like to go back and stress the circle that Lucianus mentioned before. We wanted to show that there is a big need for discovery-driven research. Without a discovery-driven research, there is no real innovation. This fuels the whole cycle. So I hope that we are on the same, that we pass the message. We are not only talking about translating innovation. It is because I represent DG Reform that I'm focusing on that. But I believe that we have to mention the full cycle and the importance of the blue sky research as well. I just wanted to add that.
Yeah, excellent. And Lucianus, your views and anything that you pick up from the chat here? And otherwise, I will ask you about pricing, about pricing of innovation.
Well, I think what my eye caught was something that was referring to the fact that certain aspects you need to consider in the program for innovation. For instance, the issues around One Health approach, mental health, and so on. If we are looking also at the concept of patient-centered care that we put in the slide earlier on, these things matter. What the COVID-19 crisis has actually started to reveal is impact on mental health. So maybe that is a call to pay much more attention here and integrate this more into the program. I'm looking for things that I would flag it as issues for patients and health systems. So this caught my eye.
It's very important when you also talk about, well, the overused resilience, but it's also so much that we can cope with. And if you then, in some countries, we already see that people feel quite hopeless or are quite depressed about what is happening around them ecologically. So there's a link between how do you feel yourself, but also if you see your environment changing, or if you see that there are more and more environmental disasters that impacts you a lot. And maybe that's a bridge to the third question, because it's also about that we would like to ask you. So maybe going to the next slide, which is really about, what are the other types of questions? And I already saw that in the comments that we need to pay much better attention to, for example, gender issues in the way we set up studies, gender issues in the way we provide healthcare. I also saw comments around especially ethics and integrity around data use and privacy issues, especially when we look for converging behavior plus therapy plus diagnostics. It's a very, very complex process. But maybe before I open the floor, we've already opened the floor to the participants here, but if you look at this very long list, Lucianus and Sasha, what would be your top 3 of aspects that we really should be paying attention to, and why? And maybe there are some aspects that are not on this list. So I would be interested in your top 3, Sasha and Lucianus.
Okay. Sasha, would you like to start?
Or maybe your top 1.
Okay. Okay, if I make a start, then from this long list, I would pick the following three. Social innovation, when it comes actually to moving forward with patient-centered care. The approach to that, the environment of patients, the configuration of services that make this happen. That's also part of reorganizing service delivery in reformed health systems. Equally important, education and training for the health workforce, but also for people. Health literacy and digital literacy come into this. And then the international and regional cooperation. Having seen a lot of work that has been done in the previous years, for instance, in the context of the European Innovation Partnership on Active and Healthy Aging, and on how a lot of authorities have similar needs, collaboration is the way forward, because sometimes you cannot configure the gold solution on your own. What we have seen also for some of the pioneering regions is that they have good parts for a solution, but not necessarily the whole package. So exchanging the knowledge and helping each other to enlarge the large part of good components for a solution is a way forward. But also I think this is what will make DG reforms work easier, and also the authorities work easier to connect and learn from others, to pick up their knowledge and their practices. These are my three top ones. Without order of preference, they're hugely important.
Excellent. And Sasha, what would be your number one or your top three?
Thank you, Henrietta and Lucianos. Well, if I were a hat of Sasha, then would be definitely ethics and integrity and open science. Because I think that without open science and collaboration, as Lucianos mentioned before, we cannot actually move on. And ethics goes hand in hand with new scientific discoveries, with blue sky research, and so on. If I were the head of DG Reform, and also the citizen, I think that education and training is super important. This is what we see everywhere. And of course, last but not least, how does the market, the system, uptake all kinds of research and innovation, and how does it bring it to the citizens, which are our final destination? Thank you very much.
Thank you. And I really I see that many participants are commenting on this, and it's quite interesting that, because I see a common theme about the cooperation across scale, from local to regional to national to international, and where would we, what would be for which question the best way of getting ourselves organized? What would be the most? It's really about the how. I also see that the focus should really shift, and this is what Lucianos also mentioned about who is the patient, but also who is the healthy person that we would like to engage with, that and what are their needs, and how can we better tailor and deliver health research impact for them. And then I also see a lot about education, and this, and sometimes there's quite an evangelical distinction between you do education and you do research and innovation, and a big wall is cemented. But what I see here is that to create impact, the education and the skills part is really integrated in the whole transformation side. So especially then when you come in with green skills and digital skills. So I really enjoy reading the inputs of the participants, and I would like to thank you all very much for that. I'm also aware of timing, and one of the not so good things of doing an e-web conference is that we will be kicked out already at 10 o'clock. so sharp. The next point is really trying to wrap up some of the main points that you all as participants have brought forward. And I now have in front of me a number of bullet points that were collected by the team here in DT Research and Santé and Reform. And I'm just going to summarize these, and then I will bring in Lucianus and Sasha for one final short statement, and then I will wrap up. So it's now the time that I summarize some of these points. Yeah, and we have still a few minutes time. So, and this sounds, the participants, maybe like a very long list of bullets, but it's really a summary of your inputs, and we're going to summarize these further, analyze these very carefully, and make sure that your inputs are reflected. So the first part, really on question 1, was around digitalization. Doing this safe, secure, secondary use of data, but also solutions should be really for citizens and with citizens. And there, the element of social and cultural practice becomes so important, because we all have a common value set, but also something that the health is so deeply personal. You also mentioned, I remember clearly in the first question, that it's about cross-sectoral collaboration, from materials to fundamental research, to academia, industry, and clinic, and involving healthcare providers. So this, the challenge is then how to translate fundamental research better into medical interventions. And there I really liked this nearly cycle of healthcare life, where we involve everyone and help everyone to see how your results, how the research is being taken up. And we are talking in this session about a timeline of 5 to 20 years. So we really need to invest more, according to you, in a fundamental understanding of health and disease. We saw that with COVID, it's very important to link research data to healthcare decisions. I'm just going to go further. And there, I really like the comment of one of you saying that improving health systems is a marathon, not a sprint. And indeed, if you do it in a sprint, I used to do a lot of sports, you get very tired. But a marathon is something that is also a little bit painful, but you get there, and it takes a long endurance time. So going to the second question. Is this all with the first question? I'm just looking at my colleagues here. Yeah. Going to the second question, I really liked your comments about even if we want to be green, digital, and healthy, this means really a radically turnaround of who and what to involve in healthcare systems. So sustainable manufacturing, across sectors, collaboration, really understanding what the patient needs and what the patient wants, which will change over time as well. We've seen that already with COVID-19. Looking at prevention, but also investing in prevention a lot more. So this digitalization is a major issue around that, both an opportunity and a challenge. An opportunity in AI, cloud data, a challenge in what are we going to do with privacy. Maybe a final point is we not only have a circle in healthcare system, but also a circular economy. So circular in our production systems and how we do and provide healthcare. And maybe that would be a final point where for 1 or 2 sentences I would like to bring in. So Sasha and Lucianus, we have 2 circles, the healthcare circle and the circular economy. How can we connect those circles? Maybe in 1 or 2 sentences.
Maybe as the final message, I would just like to say that there was a question on where do we start and how do we have to think. I would say we have to think European or global, but we have to start locally, act locally. And that's my final statement. Thank you.
And Lucianos?
From my side, yes, I think conceptually we shouldn't have any doubts about the health cycle and the economic cycle. One of the lessons from the COVID crisis is that we need to have well-performing and well-functioning health systems.
Mm-hmm.
Otherwise, things around us fall apart. The financial implications of this crisis, stemming from the fact that health systems could not cope with what was thrown to them, are pretty much dire. Everybody, I think, acknowledges that. So
Yeah.
I think we cannot say that these two cycles do not meet.
Okay, excellent.
As a final comment, what I would like to say is I'll take the example of the marathon.
Yeah,
As
very short, because we're running.
Reforming health systems is indeed a marathon.
Yeah.
And to run a marathon and finish it, you need to be well prepared, determined, and resilient.
Excellent. Thank you very much. And I see here from the comments that for that we need all of us, all of you, in member states, in regions, and local authorities, all the programs that we can have, and combine everyone around and gather everyone around these objectives. And I would like to thank you, Sasha and Lucianos. I would like to thank you as participants. I would like to thank the team here in DG Research and Sante and the Commission for all their support. And I'd like to thank you all for contributing all the inputs. We will look at these very, very carefully. And thank you again for all your enthusiasm and for co-designing this session with us. Thank you very much.
Thank you very much.
Thank you. Bye-bye, everybody. Thank you.
Bye.
Yeah, offline. Yeah, well, anyway, I'll tell you from this.